Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself. No? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's non-enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors. The number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwedeng sa powder, ako po pwedeng sa PPARs Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong. Tapos very honest sila sa mga sa mga pagsagot sa mga questions. Basta nasasayahan ako. Ganun.
We're always with you from start to healing.
Magandang araw po sa inyong lahat. Ako po si Ciela, ang inyong host, at narito po tayo muli sa Simply Nature Success Stories. Napakapalad po natin ngayong araw dahil napaunlakan po tayo ng isang lung cancer patient na may very inspiring story na ibabahagi po ngayong sa ating lahat. Magandang umaga po, Ma'am Violeta. Salamat po sa pagpapaunlak niyo sa amin ngayong araw na ito. Maaari niyo po bang ipakilala ang inyong sarili sa ating po mga manunood?
Okay. Sige, salamat sa inyo. Ako po si Violeta. Magsi-67 years na ako. Na-diagnose po ako nagkaroon ako ng lungs cancer na stage 3C. Halos stage 4 na daw yun. Ay, nung 2022, nag-ubo-ubo na ako pero gumaling. Tapos nung 2023, inuubo na naman ako. Hanggat sa ang plema ko is may dugo. Hindi ko yun sinabi sa mga anak ko. Nilihim ko yung gawa nga ng akala ko TV lang. Mga buwan ng May, sinabi ko sa kanila. Alam naman nila yun na ubo ako eh. Pero sabi ko, hindi na maganda. Ang sabi ko, may dugo na yung ko. May dugo na yung plema ko. Di pina-x-ray nila ako, mayroon ng findings na mayroon bukol ang lungs ko. Ang ginawa naman ng doktor, naman ako, CT scan with contrast. Yun nga, nakita ang bukol sa sa lungs ko is malaki na. Hanggat sa napansin ko naman na mga buwan ng June o July, mayroon na ako nakapa dito mga bukol. Sa liig ko binayopsy. Hanggat sa dumating ang result ng biopsy after 2 weeks, hindi na maganda. Dahil nga sa mayroon akong lungs cancer, stage 3C. Ayaw ko kasi nagpa-chemotherapy noon. Pero dito sa bahay, nagpakuha ako ng oxygen tank, malaki. Hindi na ako nakakakilos kasi noon eh. Halos nakahiga na lang ako, pupunta ng CR, pagbalik ko salpak agad ng oxygen. Dahil sa grabe na nga. Talagang ang isip ko, kung anong gamot ang makakalunas.
Kayo po ay gumamit ng Simply Nature PPARs. Ano po yung mga naramdaman yung kakaiba o pagbabago?
Nung dati pa man, bago ako binayopsy, na nagsisimple nature na ako siguro mga mahigit ng 1 buwan, Maganda dahil yung dugo ng plema ko nawala doon sa PPARs liquid. Nawala yung dugo. Hanggat sa ma-biopsy nga ako, mabigyan naman ako ng yung gamot ng biopsy, magaan na ang pakiramdam ko kasi wala naman ng dugo.
Naisabay po ninyo itong Simply Nature PPARs dun sa GPT-NIB po, no, yung targeted therapy po, na nasabi ninyo kanina. So, nagkaroon po ng magandang improvement sa loob po ng isang buwan, tama po?
Mula nung mag-PPARs liquid ako, na mga nakakailang box ako, nawala yung dugo sa plema ko. Yun naman ang guminha-ginhawa ako. Hindi, ang pagdating ng result ng biopsy at naresetahan ako ng GPT-NIB, ang bilis lang. 4 na beses lang akong nakainom, nawala na yung ubo ko, nawala na yung plema ko.
Para po sa kaalaman ng lahat, ang isa po sa maganda sa Simply Nature PPARs is kapag po ito ay naisabay sa conventional treatment, kagaya po ng chemotherapy o kaya po prescription medicine po na re-prescribe po ng mga oncologist, ay may pagkakataon na mas napapalakas po natin yung bisa or yung effectiveness po, no, ng mga gamot na ito at mga treatment na ito, lalo na kapag kasabay po ng PPARs. So, I think ganun po yung nangyari po sa inyo. No?
Kasi bago pa man ako na diagnose ng may lungs cancer ako, ayon doon sa biopsy, nainom na ako ng PPARs liquid, saka PPARs ng tablet. Nawala yung plema ng dugo ko. May 1 buwan na rin. Ang ganda ng epekto sa akin. Ang sigla ko na, 1 buwan, 1 linggo, hindi na ako nahingal, hindi na ako nag-o-oxygen.
After po nun, so nagtuloy-tuloy po kayo ng gamit din po ng Simply Nature PPARs?
Hanggang ngayon, nag-Simply Nature pa rin naman ako for prevention. Na pampalakas din ng resistensya. Hanggang ngayon, nag-iinom pa rin naman ako.
Pati po yung mga nodules o yung kulani po ninyo, no? O bukol sa leeg, ay nawala.
Nung nainom na ako nung GPT-NIB, yung mga bukol dito nagdamihan, ang dami po na talaga dito ng bukol. Awa ng Diyos. Unti-unti na rin yun, araw-araw, kada umaga, kinakapa ako, ang liig ko nawala. Pero tuloy-tuloy pa rin naman ng inom ko nung PPARs kasi yun nga ang nakakaganhawa sa akin. Pag nakakainom ako noon, medyo malakas, parang maginhawa bang huminga. Kahit may iniinom naman ako ng hindi na ako hindi na ako nag-oxygen. Kasi nga maginhawa na ang paghinga ko. Hindi naman sa wala akong tiwala sa mga chemotherapy, pero ang dami ko na kasing nakikita na mas lalong daming naaapektuhan ng chemotherapy. Kaya ang ayaw ko talaga ng chemo, hanggat maaari gusto ko na lang yung alternative medicine. Yun na nga, di naman din ako nagpabaya na binibilhan naman ako ng mga anak ko ng mga daming mga herbal. Pero ang naramdaman kong mabisa o maginhawa sa pakiramdam ko ang PPARs. Kaya yun ang tinuloy-tuloy ko. Basta ako mahigpit akong sinasabi ko sa kanila, ayaw ko ng opera. Ayaw ko din ng chemo. Kasi hindi ko kakayanin na yun. Mag-antay-antay tayo ng panahon kung effective itong kasi ang tinira ko na lang, hindi na ako nainom ng iba pang mga alternatives. Sabi ko, ito na lang, dahil ito ang nakakaginhawa sa akin, PPARs nga.
Last January, nagkaroon po kayo ng CT scan. Ano po yung dumabas na sa CT scan ninyo netong January po?
Sa CT scan nitong January, ito lang 2024, is maayos na. Hindi na, wala na yung mga bukol. Kasi kahit si Doc Jansen naman noon, gusto niya na rin ako ma-CT scan para daw malaman, curious daw siya kung ano daw yung nangyayari na sa bukol ko. Maayos na, wala na yung mga bukol. Parang cavity na lang daw yung naiwan ng mga pinag-alisan ng bukol. Yun.
Dito po. So parang ito yung parang naging resulta po, no? Nung pag-combine po ninyo ng PPARs at saka po ng GPT po, no? This past months po. ano po yung mensahe na pwede nyo pong maibahagi sa kanila sa mga katulad po ninyo na nasa kalagitnaan po ng cancer journey?
Laban lang. Huwag tayo mawala ng pag-asa. Ang cancer, nagagamot. May Simply Nature, may PPARs, maganda. Yun talaga ang naranasan ko na guminhawa talaga ako. Nung medyo inatake ako ng todo, gusto ko uminom kaagad, kaso lang kaiinom ko lang. Dahil yun ang maginhawa sa pakiramdam ko na. Pag inuubo ako, nakakaginhawa naman talaga.
Ma'am Violeta, maraming salamat po sa pagpapaunlak niyo sa amin at pagbibigay po ng panahon para maibahagi niyo po yung inyong inspiring story po no sa ating mga kapwa-pasyente na nasa kalagitnaan o may pinagdadaanan din pong laban against cancer.
Hi, ako si Violeta, 67 years old. Na-diagnose po ako ng lungs cancer, stage 3C. Dati po, hirap ako sa paghinga, naubo, at ang plema ko lumalabas, maraming dugo. Talagang hindi ko na rin alam kung paano. Nung mag-take po ako ng Simply Nature's PPARs liquid at PPARs tablet, maginhawa po ang aking pakiramdam at nawala po ang dugo. At sa ngayon, hanggang ngayon, maayos na po ang pakiramdam ko. I trust Simply Nature. Maniwala po tayo.
Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself, no? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's non-enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you are taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors, the number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwedeng sa powder, ako po pwedeng sa PPARs Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang ano, kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong. Tapos very honest sila sa mga sa mga pagsagot sa mga questions. Basta nasasayahan ako. Ganun.
We're always with you from start to healing.
Hi everyone! Have you ever wanted your oncologist, your surgeon, and your integrative doctor all on the same stage at the same time to answer your questions about cancer and your cancer journey? Well, the opportunity is now right here. It's happening. Simply Heal is going to have its second face-to-face event, Beating the Odds, Medical Nutrition, Oncology, Surgery, and PPARs in Fighting Cancer. So join us on July 27th at SMX Aura, 8 a.m. Click on the links below to register for on-site or join us via Zoom. See you there, July 27th.
And we are live. Good evening, everyone. My name is Jen, a board-certified pharmacist and your health advisor here in Simply Nature. We have a very informative session lined up for you. We are going to discover an effective management of cancer treatment by incorporating PPARs Agonist. So whether you are newly diagnosed, already ongoing treatment, a survivor, a caregiver, or simply interested in promoting health and wellness, this free webinar is for you, so please tag and share with your family and friends. Also, feel free to use the comment function to ask questions during the presentation, and we will address as many as we can during the live AMA or Ask Me Anything segment towards the end. But before that, just a quick recap. Last week, Thursday, we discussed about the major role of supplementation for breast cancer. So for those of you who missed it, just replay on our YouTube channel, search for Simply Nature, no spaces, and don't forget to subscribe while you're at it. Now, moving on, without further ado, let me call on our seasoned international speaker on a wide range of topics, from personal success to healthcare, who is also the founding director of Simply Nature International, our PPARs expert from Singapore. You all know him. It's no other than Mr. Shyan Lim.
Hi Jen, thank you for the introduction. Tonight we have another topic that is quite follow-up from last week's topic. So we look forward to the discussions that we will be having during the AMA segment after the initial discussion. So I look forward to it. Remember to stay back and we'll do our best to answer as many questions as possible. Welcome everyone. I'll hand the time back to Jen.
Thank you, sir. Next is an honor to present our second esteemed speaker, Dr. Jansen Kalalan, a distinguished graduate of St. Luke's College of Medicine, a diplomate of not only the Philippine College of Lifestyle Medicine, but also the International Board of Lifestyle Medicine, currently serving as a consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group. Dr. Kalalan specializes in the treatment of cancer and metabolic illnesses. Let us all watch this.
Hi everyone, welcome to another episode of Simply Healed. And again, we have our regular Dr. Jansen with us today.
Hi, hello Sean, hello everyone. Glad to be here again and welcome to Simply Heal.
Today, Doc, we want to talk about a very exciting aspect of cancer treatment, which is immunotherapy.
Yes.
Doc, the thing that struck me most about conventional immunotherapy, or really for conventional immunotherapy, is that we always have the understanding that when you go for immunotherapy, the drugs will strengthen our immune system, and that's how we defeat cancer.
Okay.
Is that the right understanding? Because you were telling me actually immunotherapy is like vaccination.
Yeah. So what you just said is wrong. Okay.
Oh, it's wrong, everybody. Okay, so immunotherapy is not to strengthen your immune system. So how does it fight cancer then?
Okay. Immunotherapy. So with the words, right? Keywords. Immuno, which means immune system. Then therapeutic. Yeah. So with this class of anti-cancer drugs, it's basically using your immune system to destroy the cancer cells. Okay, so how does it do that? It does not boost in whatever way your immune system. What it does is to help your immune system recognize the cancer. Okay? in that way, it's really similar to vaccines. So vaccines, as everyone already knows how vaccines work, right? So the vaccines is it's the virus itself without the fangs. Okay, so it's given to you so that your immune system will be able to recognize the virus without the fangs, no? So that the next time that you get infected with the virus enters your body the next time around, your immune system can easily overwhelm the virus. So it's sort of like, helping the immune system recognize, okay, this is the enemy. Okay, so immunotherapy also works in that way, right? So I'll give you a specific example right now.
All right.
Okay, so for all of those, for those of you who are breast cancer patients, okay, breast cancer has a certain type, okay, HER2 positive. I'm sure those breast cancer patients out there
will know what that is.
Yeah, will know what this is, what I'm talking about. Okay, so if you get a HER2 positive breast cancer, okay, as a drug that is always given to you is trastuzumab. Trastuzumab, the proprietary name, trastuzumab is the generic name. The proprietary name is Herceptin. If you are familiar with that, no. So what trastuzumab does is, okay, first, what is trastuzumab? Trastuzumab is a monoclonal antibody. Okay, so antibody. Okay, so the pill in itself has antibodies for what? For recognizing the HER2 receptor. So HER2 is a receptor that is expressed on the surface of the breast cancer cell. Okay? Now, usually when HER2 is when you're HER2 positive, usually that's aggressive. But with that HER2 positive receptor poking out of the breast cancer cell and you being given trastuzumab, the trastuzumab will function as a bridge between your immune system and that breast cancer cell, so that your immune system can recognize, okay, this is the breast cancer cell, I will destroy the breast cancer cell. Okay, so that's how it functions.
So Doc, clearly it means that I was one of them too, and I think many of the patients, maybe even some patients who are going for immunotherapy today, your understanding of how immunotherapy works might be that common misconception, is that the drug that you're taking is strengthening your T cells, your NK cells, the cells that kill the tumor. No, it's not. Immunotherapy creates the bridge between your immune system and the cancer cell. So it helps your body recognize the cancer cell. Doc, for conventional immunotherapy, that means the one that we get from our oncologist, the normal protocol is first to combine it with chemotherapy?
Usually, but it's case to case. But more often, depends on the stage as well, no? If you are on a more advanced stage, usually what oncologists do is to start you on chemotherapy first. Then once you're done with chemotherapy, they start you on immunotherapy.
Why the chemotherapy first?
I would surmise, no? It's because number one, chemotherapy can be given for a shorter period of time. Because immunotherapy, usually you would have to be on it for around 2 years. Okay, so longer period of time. So, but aside from the timing, okay, it's because chemotherapy is sort of like a nuclear bomb. So you bomb all of the cancer cells first.
Make them weak.
Try to shrink them enough so that your immune system, once you are already given immunotherapy, your immune system can, easily pick off the smaller bits and pieces of the tumor or the cancer cells. Okay, so it sort of like works like that. And also, why chemotherapy? Why do we need it? I'm always, if you have noticed, I'm always advocating should use all options that is available for you.
All options.
All options. It's because cancer cells can evade the immune system. In the first place, that's why they grew. It's because they were able to evade the immune system in the first place. Okay, that's why it's there. So now, with that, knowing that, it's not enough to boost your immune system alone. Yeah, it's not enough to give you immunotherapy alone. Okay? You should be able to kill off those cancer cells that has been evading your immune system. Okay? And then afterwards, then target the
ones that your
the
immune system
can
can recognize.
recognize. Okay? To target the more specific, the smaller cells. Because in that way, it's easier to pick off smaller bits and pieces
Yes.
of cancer cells rather than a big chunk of tumor, right? It's always very difficult to fight cancer if the headquarters is there. Okay, so that's also one of the reasons why, we need surgery as well. Okay.
Wow, Doc,
So-
thank you for that very clear explanation. And Doc, how would you then position or share how does Simply Nature's liquid extract work as a natural immunotherapy?
So Simply Nature PPARs liquid works in both phases, the chemotherapy and the immunotherapy phase. Now, the benefit of the Simply Nature liquid extract in the chemotherapy phase is to preserve your bone marrow. Okay? So one of the side effects of chemotherapy, I'm sure all of you know, your blood cells count usually decrease. You get
Both your
anemia,
red and white blood cell counts.
Everything. Okay, so your platelets, your white blood cell count, your red blood cell count, those decrease. Why? It's because chemotherapy can be toxic to the bone marrow. The bone marrow is where these blood cells form. Okay?
So Doc, it's so important. If any of our patients and listeners are planning to go for immunotherapy, which is expensive, and they have to go for chemotherapy first, then it's imperative. It's so important that they protect their bone marrow, because if the bone marrow is compromised due to the chemotherapy, the immunotherapy
it won't work as
it won't work as well.
Yeah.
So to all our viewers on the program, if you are ever planning to use immunotherapy and you have to go for chemotherapy first, then do something to protect your bone marrow, because your immunotherapy does not strengthen the soldiers that are produced by the bone marrow. The immunotherapy provides the bridge for your soldiers to recognize the cancer cells. Now, if your bone marrow is destroyed, the immunotherapy's efficacy will also drop.
Yes.
All right.
Exactly.
Exactly. All right. Now, Doc, we know that our PPAR liquid extract, Simply Nature's PPAR liquid extract, protects the bone marrow, but our extract also improves dendritic cells. So, am I correct to say, because you helped to explain that the vaccine or the immunotherapy, I'll use terms that for our viewers easier to relate. So, the immunotherapy is like a vaccine for the cancer. It's tailored to a particular strain of cancer.
Yes.
And cancer can mutate, but often not so much.
Yeah.
But there is a chance.
Yeah, there's a chance. Yeah.
So that would mean that it's important for your own dendritic cells to also do their job.
Yes, they should be able to do their job well as well.
So so PPARs liquid extract would actually work together with immunotherapy. The immunotherapy drug will send most of your soldiers to attack the main tumor, because your soldiers can now recognize the cancer tumor. But it is important for your dendritic cells to still be working. You cannot depend only on the immunotherapy drug, because what if your cancer mutates differently from the immunotherapy drug? Then you really need your own body's dendritic cells to identify this small breakaway guerrilla force and kill it before it becomes recurrence, right?
Yes.
Yeah, because you can have a successful immunotherapy after chemotherapy and you can go into remission.
Yeah.
But the recurrence happened because it broke off escape detection, because this new strain was not designed for the immunotherapy drug. Just like we now ask, right, for COVID-19 whether Sinovac is effective, and it's true that Pfizer is the most effective. So Pfizer dealt with mutation much better than AstraZeneca and Sinovac. So it very could happen to you also that your immunotherapy for your particular cancer might not deal with the mutation as well. So you need to make sure your own dendritic cells are active. And for that, it is proven Simply Nature PPAR liquid extract improves dendritic cell activity.
Yeah, and not only dendritic cells, okay? It has been shown, an observational study, dendritic cells, not only dendritic cells increase, but the natural killer cells, which is actually the soldier that destroys all foreign bodies, all abnormal cells, okay? It's the natural killer cells also increase, your T cells also increase. Okay, so that's that's also one of the benefits of
So that
liquid
means,
extracts.
Doc, I mean, from what you are sharing right now, it sounds like that the immunotherapy drug, conventional immunotherapy drug, strengthens the bridge, but does not strengthen the soldier.
Yes.
However, Simply Nature liquid extract strengthens the soldier. So that means it's a good pair up.
Yeah, it's a good pair up. It's actually should be almost always given together. Yeah, but I would the strategy that I would do is to give PPARs extract first before you go for the immunotherapy.
Oh, strengthen the soldiers first.
Strengthen the soldiers first, make it really sensitive, then give the bridge.
Give the bridge, and the soldiers will cross the bridge and
Cross the
attack
bridge,
the cancer cell and help you win the battle, win your fight against cancer.
Yes.
Doc, I think we've highlighted so many interesting facts. I hope that the viewers are really getting understanding because we're seeing questions come up. So let's go to our Ask Me Anything session, and I'm quite sure there'll be lots of questions about immunotherapy today.
Yeah. All right. See you in the Q&A.
There we have it. So at this point, questions are very much welcome. Just type them down in the comment section below. But just before we go to our AMA or Ask Me Anything portion, quickly, I just want to greet our avid viewers. Mavs Agot, Felicissima Siman, Lucy Mariana, and Miss Janet from Child House. Webinar is not the same without you. Now, to answer all your questions in this modern world filled with noise of different health opinions, only trust the ones from the experts. May I call on once again Mr. Shyan Lim.
Hi, Jhen. Looking forward to answering everybody's questions. So let's go. Jhen, do you know if Doc will be joining us tonight?
No, I think he still have the acupuncture class.
Yeah. Okay, everybody. So Doc today is preoccupied with his acupuncture class. He's doing TCM. So it's always good news because Doc Jansen will be able to share from a new perspective as he also adds to his knowledge-based traditional Chinese medicine. And I think also he'll be going for like a honeymoon trip in the early week of July. So it'll be sometime. I'll be here to answer your questions as best I can. My focus is definitely going to be on PPARs and PPARs protocol. So let's do that. But I'll try to answer as many questions as we can also, even on those on nutrition and some questions on cancer because we have so many patients.
Okay, I can see a lot of questions coming up and thrown privately. So let us start the live AMA or Ask Me Anything portion. First question coming from Facebook, Miss Cheches Lelan. Doc, my mother have stage 3 breast cancer and been checked up lately. The doctor gave her oral med chemo because around her right breast and have other one on the left. So Doc, what PPARs protocol can you suggest to my mother? And hope you can help us. And thank you so much po and God bless.
Hi, Sheshe. So first off, I hope you understand what stage 3 breast cancer means, okay? Stage 3 breast cancer means that your mom's breast cancer cells have already spread from the original position. So, and you have mentioned on left breast and right breast. So now there's another one on the left breast. So the first thing that we want to do is make sure that you don't progress to the next stage, which is to spread further away. Then it goes maybe to the liver, the kidneys, the bones. These are the next thing that we want to avoid. Okay, so good news is at stage 3, breast cancer has a very good survival rate, especially with targeted therapy and chemotherapy. I guess that's what your mom is taking now. Okay, now let's talk about PPARs. So how is PPARs going to help your mom, right? You've heard from the discussion just now with Dr. Jansen. PPARs is going to help your mom in multiple ways. Number one, it will modulate or control inflammation in the body. This is not simply your antioxidant. This is the PPAR agonist actually triggering the inflammation modulation pathways in the body. So that's very different from just taking antioxidants. Okay. It will also strengthen your immune system. Okay. So that is going to affect your immune system is still going to mop up, and it's very important what your immune system does when your mom successfully finishes her cancer therapy. Okay, because your immune system is able to pick up all the cancer cells that are spreading throughout the body to not allow it to find a foothold and develop another tumor somewhere else. Okay, so that's another thing. Now, your mom is undergoing chemotherapy, oral chemotherapy. Oral chemotherapy, like all chemotherapy, has its side effects, but the benefits are very clear as well. So what you will do with the PPARs is that the PPARs is going to help protect your mom's bone marrow and also her spleen and other organs. Now, I specifically focus on the bone marrow because that's where your mom's immune system is actually located, produced, right? It's your bone marrow cells that will mature into red blood cells and white blood cells. Both are very important. They are literally your immune system. So this is what you want to do. Okay, which PPAR protocol will work for your mom? I will start with the best. Okay, the best will be our liquid PPAR extract. Okay, now how long would you use it? I would suggest to start with 1 month. Okay, and then after that, go for a scan. Right. So what would be good is that you take your PPARs protocol and time it also, and go for your next scan that your onco has scheduled for you. I am sure your onco has scheduled a scan for you because even when you use oral medical chemotherapy, they will schedule a scan to see how it's progressing so that they can check on the dosages or whether they need to switch to another chemotherapy mix or not. Okay, so don't skip out on the scan, everybody. Remember, why do we go for diagnostics, right? We go for diagnostics to know how our medications and protocols are doing so that we can make adjustments, all right? So that's it. Now, if apart from liquid PPARs, you can also use jar, powder jar, and soft gel, but definitely you want to start on the liquid. So I would recommend starting on the liquid for a month and then afterwards review. Now, I just had a talk last night with a family of doctors from the province. They actually own like a really big clinic, and within that family, there were psychiatrists, pediatricians, ENT, a whole basically almost everybody at the dinner table was a doctor. And this is because they were one of the doctors, one of the family members has cancer, and they wanted to look for natural way to manage the cancer. Of course, it's very interesting in a family of doctors, right? Many of them wanted the family member to go for chemotherapy. The family member's choice of hesitating for going for chemotherapy was actually because of age. Okay, it's because of age. So he was aiming for quality of life. Now, we discussed about it, and again, in my discussion with the doctors, one thing that came up when we came to treating cancer has a lot to do with your finances as well. Okay, so if finance is not an issue, always go for the liquid. So in our advice, we always don't take into consideration finance because we believe every one of our viewers want to know what's the best option. Now, please talk to the CSO, indicate your interest, and they can advise you also on your budget, right? We can also advise you on your budget because the protocol that you want to choose, you want to have a plan of the protocol as well. You want to make sure also that you can sustain the protocol over long term. So it's definitely better to take PPARs protocol and being able to take it more than 6 months rather than just take it for 1 month and then after that can't continue anymore, right? So we're going to help you also plan with your budget. And don't worry, just because there are different forms of PPAR extract powder or PPAR extract liquid, it does not mean that your chances of survival drops simply because you use PPAR powder. Okay, because there are other things you can do to help boost the effect, like manage your lifestyle. Okay, so not just the protocol, but also your lifestyle. But like I said, I would start with the PPAR liquid extract, 1 vial a day, every day for a month. Okay. Now, if you're going to opt for the powder, it'll be stage 3. It'll be like two scoops a day, 2 scoops 3 times a day, every day. Also, you're going to see effects. If your mom is tired, starting to feel fatigue from the chemo, then you will actually see the improvements literally in the first few days. Improvement in energy level, about her alertness, and probably reduction of the side effects of the chemotherapy. So I look forward to hearing good news, Shay, from how your mom is doing. Do let us know. If whenever you reach out to us, our CSOs will also follow up with you to make sure that if you have any questions, they're there to answer.
Yes, please don't hesitate to message us. So CSOs, client service officers like me, Mom Sheila, and Mom Daisy advise you on how to take PPARs.
Okay, and then I just want to do a shout out also, Ms. Jhen, her title is a CSO, but she's a totally qualified, fully pledged, board certified. Actually, her son, she has nursed her son back from 4th stage nasopharyngeal cancer. So again, and Miss Daisy just joined our team, but also very well versed. So our team is.
She's also a pharmacist, sir.
Oh, Miss Daisy is also a pharmacist. I thank you for letting me know. So okay, so even though they call themselves client service officers, they are in the medical industry, in the know, so you can trust them when you ask them any questions. Yeah. Thanks for letting me know, Jhen.
Yeah,
Alright.
and I would like to read a very comment from Ms. Mabzagot. She said, I trust Simply Nature. It helped me a lot in my cancer journey, and thanks God I discovered Simply Nature.
Yeah.
So watch out for her success story soon.
Oh, that's great. And Sheche, if you are living in Metro Manila or nearby, okay, do come and join us live on July 27 in SMX Aura in BGC, not MOA. Okay, SMX Aura on BGC. It's a Saturday morning, 27th of July. We're going to have a live panel, right? So it'll be great if you start now. That would mean that after that, your mom would have taken the products for 2 weeks. 3 weeks, right? And then Dr. Jimmy will be there, Dr. Jansen will be there, I will be there. So it's like free consultations with 3 experts. And you can share, we can follow up. You can ask about questions about how your mom is doing, any follow-up as well. So Shishay, if you can make it, we would love to have you. Okay?
Yes, you can see from your screen the GCash payment. So we will tell you more details later on how to register. Yan. Okay, next question from Miss Minda Banella. Can I only take PPARs tablet? Will it be sufficient to kill colon cancer cells?
Okay, the straight answer is no. All right. For any cancer treatment, the therapeutic effect is going to be on the extracts. So I will definitely go for powder and liquid extract. Okay, now what is the tablet good for? The tablet is good for maintenance and support. Okay, what will the tablets do? The tablets will help lower your blood sugar, manage your blood cholesterol. It will help with the chronic inflammation. But all this is at a level for general health and metabolic syndromes like diabetics, hypertension. Now, when you talk about cancer, you have to understand, when you have cancer, it means that your own body could not deal with the, how shall we say, the cancer cells coming together and forming a cancer tumor. So you then develop cancer. So you want it to be more powerful. You can't just, it's simple. When you take vitamin C for your general health, you take a vitamin C capsule maybe every morning or something like that. But when you are having a flu, having a cold, you don't take the same dosage of vitamin C that you do on a normal daily basis. So that's the difference between tablets and the extracts. Now, for the tablets for cancer patients who are already on remission, that means you are cancer-free. and you want to take a basic supplement that is good for your health, with your metabolic syndromes, your inflammation, and specifically good for keeping you anti-cancer, then the tablets is sufficient. All right. But when you actually have active cancer, actively fighting cancer, no, you have to go for the extracts. Okay. Yeah.
Okay. Next question coming from Antonio Laulita. How about skin itching po? Normal lab results.
Okay, what skin itching? So I don't know. This question is very vague. All right. Okay, but again, back to the dinner I had last night with a group of a family of doctors. Some family members has eczema, psoriasis. So if you have skin itch that is an atopic dermatitis, okay, that means eczema, psoriasis, and other similar skin issues, it's actually an immunodeficiency. It's your immune system attacking your skin. That's why you feel itchy, okay? It's not a skin disease, it's an immune disease. If you fall into this category, then what I will tell you is that the tablets should be sufficient already, unless you have quite serious eczema or psoriasis, then you want to go for the soft gel capsule. And in the extreme case, that means in very, very bad psoriasis, then we go for the powder extract. But in general, truly, the soft gel capsules and the tablets would be sufficient if you have any atopic dermatitis, okay, which is eczema, psoriasis, and similar. Another thing for your itch, okay, is AD Pro. Okay, AD Pro is one of our newest products. It's actually a therapeutic level probiotic. So you want to be able to use that instead of steroidal creams. Once you apply that onto your skin, within 10 to 15 minutes, the redness will actually subside. It's totally natural. Yesterday, we were talking about it because it's great for kids. It's great for kids because, and you can use it on your face, right? Because any steroid creams, the dermatologists will try their very best to avoid using steroids on the face, because your face, the skin is very thin, which means the steroids actually enter your bloodstream easier. All right, so that's why they always avoid using steroidal creams on the face. So AD Pro will be a good one. The latest addition to our business to business. So we have a team of, in Simply Nature, we also have a team that deals and supports the doctors, right? So that means, supports our doctors who use Simply Nature PPAR protocols. So the newest person to our team, she has very bad pimples, right? And then she's been using AD Pro and all the redness is gone. So, and that helps to manage, of course, the itchiness and the inflammation. So I don't know what your specific skin itchiness is, but if it's immune system based, then the tablets and the soft gel is how you will permanently address the root cause. And AD Pro will help relieve you in that process, because as you're addressing your itchiness of the skin for eczema and psoriasis, it will take at least 1 to 3 months. In the meantime, you're going to itch. So that's where the AD Pro comes in.
Yes, and good news, actually, our tablets and soft gels are on sale. So I will give you more details later. Okay. And actually, AD Pro is also 100% hypoallergenic. There's no additives. There's no steroids on it. It's safe to use on the face and even on the genitals. Okay. And it's also food grade. So it's safe even for babies' accidental indigestion, right?
Yeah, I mean, Jhen, when you mentioned the genitals, it's really true, right? Because also that's a sensitive area, and you don't want to have further complications when you use very strong drugs in that area. And I'm sure for both ladies and guys, you will worry if you use steroids or something very strong and near your reproductive organs, which everybody values very much, right? So yeah, AD Pro is great. And surprisingly, I actually use AD Pro when I do sports and running, because sometimes in our inner thigh area there's chafing, right? So because of your shorts, right? And that actually helps with prevent the rash from coming. So again, it's very natural. You don't worry about any that you're using something that might have a side effect or not good on a daily use or something like that.
Okay, moving on to the next question from Miss Eileen Labrador. What PPARs will you recommend for breast cancer with bone metastasis? Can I take PPAR before doing the chemo treatment? And when I start the chemo treatment, can I still take it?
Okay. First of all, if you have already bone metastasis, breast cancer with bone metastasis, it's safe to say that you are likely stage 3 or stage 4, depending on the location of your bone metastasis, right? So for stage 3, stage 4 cancer, our first go-to is going to be the liquid PPARs. Okay. Now, next, you mentioned you're going to go for chemotherapy. Then I would definitely suggest the liquid PPARs as a start, especially when you are going for chemotherapy. The reason is because chemotherapy actually, almost all chemotherapy damages the bone marrow cells. The bone marrow cells is the place where your immune system is produced. Why? Because your red blood cells and your white blood cells are grown and matured in your bone marrow. And your red blood cells and white blood cells are key components. They basically are part of your immune system. So I think everybody knows white blood cells is your immune system. But red blood cells are also part of your immune system, and they're very important. Okay, so straight away, the liquid PPARs. Now, there's a combination that you can use because, again, I take the effort to say this because I want all our viewers and our listeners to be comfortable sharing with the CSOs. If you ever have financial concerns, don't be shy about it. You know, Sheila had to support her son through chemotherapy for more than a year. All right, so definitely planning your finances is part and parcel of it. Okay, so our CSO are very well versed in the combination that can help you make sure that you can choose the approach that will fit your budget best, so that you get the best support and products that you can sustain. Because don't just aim, don't plan for cancer treatment like 1 month. It's really not possible, right? Cancer treatment will definitely minimum 6 months to even a year. Okay, so you're going to plan and budget what is realistic so that you can sustain. So when it comes to supporting chemotherapy and PPARs, go for the liquid. Okay? Why? You want to take the liquid first to strengthen your body, and then you will want to take the liquid after you start your chemotherapies to quickly recover. Now, how and when do you take the PPARs when you're doing chemotherapy? Okay, you take the PPARs before chemotherapy. You don't take the PPARs on the day of the chemotherapy itself. Okay, the reason is you want to allow the chemotherapy to do as much maximum damage as possible. Okay, now the chemotherapy has a half-life. Okay, what is half-life? Half-life is basically there is a period of time that the chemotherapy is active. It's usually active for 24 hours, right? But after the first 12 hours, most of the aggressive, destructive power of the chemotherapy already start to subside. That means when you do chemotherapy, the most damage to your cancer tumor cells will happen in the first 12 hours. After that, it will start to subside. Okay? So that's when you start taking the PPARs to quickly recover. So basically, just imagine this, right? Imagine Pacquiao. Let's use Pacquiao because every Filipino, he's a hero of the Philippines. So imagine how would you support Pacquiao, right? You will give him massage, give him lots of all sorts of support before the actual fight. On the day of the actual fight, you will not bother Pacquiao, right? You won't do anything extra special because it's fight night, right? You just leave him alone. He's prepared already. Now, immediately after the fight, what will happen again? Oh, then you will go for special massages to help Pacquiao recover from the fight. Okay, so that's exactly how PPARs will support your chemotherapy journey. I hope I made it simple for you to understand. Now, let me just repeat again how you will use it. You use it before your chemotherapy to prepare yourself. And then during the chemotherapy day itself, on that day itself, you don't take it so that your body will fully allow your body to experience the destructive power of the chemotherapy on the cancer tumor cell. Now, the destructive power of the cancer tumor cell will usually only last 12 to 24 hours. So immediately after that, what you want to do is recover from the chemotherapy so that your body is able to repair any damage and is in the best condition for the next session of your chemotherapy. All right. But if you're taking like oral chemotherapy, which is like a daily intake for some, like targeted therapy, then you can just use it together. Okay. Here we talk about some budget combinations, right? So one possible budget combination is, for example, you take liquid 10 days before your first chemotherapy session, and then that's your first box. And then you buy another box of liquid, and you can also buy at the same time a jar of powder. So you only use the liquids on the day before and after your chemotherapy, and then in between you can use the powder extract. This will allow you to stretch your one box of liquid over multiple chemotherapy cycles, right? And in between the cycles, you actually use the liquid powder. So some of our doctors use liquid powder, extract liquid on the patient when the patient has very adverse effects towards the chemotherapy. Okay, so again, there are many combinations, but start with the liquid and then continue to talk with your CSO. And again, I invite you to join us on the 26th of July on Saturday. We will be able to answer your question. And Dr. Jimmy Katapia actually does, right, use chemotherapy and immunotherapy. So he'll be able to share with you how he manages his cancer patient after their first cycle, second cycle, third cycle, all the way to the 8th or even 12th cycle, depending on the patient's need. So he'll be able to share with you towards the middle stage, the later stage, how does he use PPARs with his patients.
There you go. A very related question from Miss Remy Joy Rojas. Hello po, I have stage 2A breast cancer recurrent with mass at my left breast. I took PPARs powder, 2 scoop, 2 times a day, and 15 tablets of plus 2 times a day for 1 week now. And then tomorrow, I will undergo for IV chemo. Please give advice.
Okay, really, really good. All right. So the protocol you're using right now is good. It's correct. So tomorrow, what you can do is tonight, take your PPAR powder, and then tomorrow, just go for your IV chemo. After you come home, right, before you sleep, you can start taking your powder already. All right, because the effect of the chemotherapy, the strongest effects are in the first few hours. Then after that, you can go back to your PPAR powder. Now in the morning, please continue to take the tablets. Okay, the tablets are very important to support you. Okay, we don't take the powder extract on the same day of the chemotherapy because we want the chemotherapy to really hit and attack the cancer tumor. But the tablets, as I mentioned before, right? If you have cancer, the tablets is not enough. The tablets is for your comorbidities and for general anti-inflammation and all that. So take the tablets because it will help with your blood sugar levels, blood cholesterol, general inflammation, and all that. That will support you without affecting the efficacy of the chemotherapy. Okay, so do that. Take the tablets, then start taking the powder before you sleep that night. Right? And then continue with the powder. Now, I am sure once you go for IV chemotherapy, there will be a point of time where you will do a scan. Okay, when you do a scan, then you want to see how is the cancer, how shall we say, reacting. I am concerned because your cancer is a recurrent cancer. Okay, why am I concerned? Because a cancer that is a recurrent cancer can oftentimes be immune to the chemotherapy that worked the first time, right? So your first round of cancer, your chemotherapy was successful, it worked. But with a recurrent cancer, there is a chance that the cancer has developed a certain amount of immunity to the chemotherapy drugs you used the first round. So let's watch out for that. Okay, and if it's necessary, you might want to upgrade to the liquid all right, if you need a stronger protocol than the powder. Okay. So again, it's back to what's the best fit, both remember financially as well as your condition. But you're doing a perfect job right now. So just take the tablets, don't take the powder on the day of the IV drip, and then that night you can start taking the powder, especially if you don't feel too good, all right, after the IV drip.
So you're doing good. Just keep it up, ma'am. Okay, next question from Lou de la Cruz. Is AD Pro also applicable for itchy scalp? There is actually no dandruff, but scalp itches from time to time. It stops when antihistamine is taken, but still comes back after 2 days.
Okay, yes, the answer is yes, all right. The reason, you can try, okay. I'll share with you how it works, okay. When you take an antihistamine, the itch stops because the antihistamine blocks the itch signal. Right? Maron is like anesthesia. Okay, so whatever is irritating your scalp is still irritating your scalp, but you have antihistamine, you have blocked the itch signals, so you don't feel the itchiness. Right? It's Maron like taking Imodium when you have LBM. Okay, your poo-poo is still in your stomach, wants to come out, but the Imodium makes it like you don't feel it. Okay, but it doesn't mean that the bad poo-poo is not there, it's still there. Now, how does AD Pro work? Okay, whenever your scalp itches, okay, whenever there's a flare-up, especially for inflammation, right? That means redness, okay? That means redness. What will happen is that the bad bacteria will start multiplying in the area and make it infectious. Okay, so how does probiotics work? Probiotics work by introducing good bacteria so that they bully the bad bacteria and push them out. All right, it's like sending a bigger, stronger bacteria to beat up the bad bacteria. That's how probiotics work. Again, Jhen, did he mention that there's no signs, just itchiness?
Yes, he said there's no dandruff.
No dandruff, but is there redness, right? Is there redness? And what happens when we scratch our scalp? When you scratch your scalp, you break the skin, right? You might not be able to see the break. It doesn't mean that you bleed, but you scratch the surface, you will break the skin. And then bacteria and viruses will then invade the little cracks that you create from your scratching, and that makes it worse, right? Then your immune system will react, and that's why the antihistamine stops sending the signal, so it doesn't get inflamed. But if you don't have antihistamine, when you scratch, it starts to get red and then swollen. Why? Because your immune system is sending all the soldiers to the area. That's why it becomes red. That's where, and your blood carries the soldiers there. Okay, so AD Pro works differently. We're not blocking any signal. You're sending extra soldiers from outside. It's like the US coming to support Philippines. It's not just Philippine Armed Forces. It's now foreign armed forces like the US coming over to support on the surface. Okay, that's how AD Pro works. You can try.
That's a very good analogy, sir. Okay, next question from Christine Banog. Why is there still cancer recurrence for some patients who already underwent chemo?
Oh, that's a very good question. Okay, here it is, right? When you so here's the important question. When the doctor says that you have defeated cancer, that you are victorious, does it mean that you have no cancer cells in your body? The answer is no. It just means that you have no detectable cancer cells. Okay? It just means that you don't have a detectable cancer cell. So for example, if you detect cancer with your fingers, that means for, let's say, breast cancer, right? You can feel the lump in your breast. Okay, that's how you detect a breast cancer lump, right? What if your fingers are not sensitive? Let's say, some of us, our fingers, maybe we have very rough skin. So when we press, we can't feel anything. Does this mean that the cancer is not there? No, it just means that you can't feel the lump. Or maybe the lump is too small to be felt. Okay? So then you will say that, oh, I don't have breast cancer because when I press my breast, I can't feel anything. But when you go under the CT scan, then you can see the breast cancer tumor, right? But when you try with your fingers, you cannot feel. Now, what if the cancer cells are smaller than what your CT scan can detect? So if you use a CT scan, the scan comes out to say you are cancer-free because we cannot find any cancer tumors. It's gone. Is it really gone? No, it's too small to be detected. This is why your onco will ask you to do maybe 1 or 2 cycles after you have been cleared with. That means after they do all the scans, they cannot find any cancer tumors in your breast or in your body. But they still ask you to do 2 more cycles of chemotherapy. Why is that the case? Because they are trying to kill the cancer cells that are too small to be seen. All right, too small to be seen. So why does cancer come back? It simply means that the cancer, there are remaining cancer cells that escape detection. That's why the cancer recurs. Okay, that's why the cancer recurs. Now, this also happens if you treat cancer naturally also. Okay, so it doesn't mean that if you treat cancer naturally, it won't come back. It just means that your immune system is strong enough to suppress whatever remaining cancer cells you have in your body. But what happens if, let's say, you get stressed again? You had a emotional, you argued with your best friend and you got so sad and emotionally drained, and then your immune system was compromised because of this emotional trauma. Then with the weakened immune system, the cancer starts to come back, finds an opportunity to grow. Okay, and it grew, and before your immune system could kill it, it grew strong enough to resist your immune system. So that's how the cancer recurs. Okay, so that's why if you're strong enough, go for the 1-2 cycles of chemotherapy to try and flush it out. And then afterwards, you still want to strengthen your immune system because your immune system is the one that can find the smallest cancer cells in your body. Things that all your scans cannot detect, your immune system can. However, your immune system must be intact. Now, the challenge is if you go for chemotherapy, the chemotherapy will damage or hurt your immune system. So that means after the fight, your immune system is not at 100%. So it's not able to clean up all the remaining cancer cells in your body, the ones that are too small to be detected. This is why it's so important to supplement and keep your body healthy, because after you stop chemotherapy, your fight against cancer still continues. Your immune system continues to sweep the whole body looking for the small cancer cells that may have escaped and traveled to different parts of your body. That's what metastasis is, okay? I hope I've answered your question and give you some discarte. So the discarte is you want to make sure that your immune system is protected as much as possible during the chemotherapy, so that after the chemotherapy, the immune system is still capable of looking for the small, undetectable cancer cells, right? And that is the one that will prevent your recurrence. Okay? Yeah.
Thank you, Sir Shyan. I hope that gives some clarification. Next question is thrown to us privately from Miss Amy. Can I take PPARs before surgery?
Oh, you should. It's not can. You should. Okay? You should. Okay, so the reason, okay, let me give you not only before surgery, but also after surgery. Okay, there are 2 reasons. Okay, number 1, PPARs is able to help you modulate your blood sugar level. Okay, so it doesn't make your blood sugar level low, hypo. Okay, it goes down to healthy levels. So if you have high blood sugar levels, it helps you manage it down to healthy levels. It will never push it low. Whereas diabetic medication can make you hypoglycemic. Okay. Now, so how this helps with surgery is, in surgery, you want to make sure your blood sugar levels are good. You want to make sure that your organs are also healthy. So PPARs is a great liver aid, kidney aid. Again, like we say, why a cancer patient takes PPARs, because it helps with the production of red blood cells. So imagine in surgery, what do you lose? you lose blood, right? So your body will be producing new blood. So you want to like already strengthen your body, give it all the nutrients, stimulating it, making sure that before surgery you have as much red blood cells as your body should have, and after surgery your body's going to try and produce new blood to replace the ones that you've lost, right? So again, that's going to help. So the answer is yes and yes and yes. All right. And then don't worry, there's no contraindication with your medication.
Okay, we're almost at the end of the webinar. This will be our last two questions for tonight. So very quick, from Miss Lodi Gonzal. Is it okay to eat tofu for triple negative breast cancer stage 2B? Thanks po.
I believe yes, but Jhen, please ask this question again with Dr. Jansen next week. In general, for all cancers, right, it's okay to eat tofu. Dr. Jansen says that before because there is a lot of fear because people say tofu contains or promotes estrogen and things like that. So that's related to breast cancer, and that's why many people are afraid that tofu is bad for breast cancer. So this is actually debunked. Good source of protein. As cancer patients, you need protein. Okay, but let's ask Dr. Jansen again so that he can give us the full story behind why people thought that tofu is not good for cancer patients, especially breast cancer patients.
Okay, so watch out for our next webinar.
Right.
Okay, next question. Is it okay to take PPARs powder during radiation days for breast cancer stage 1A? How many scoops and how many times a day?
Okay. I would say that radiation therapy is different from chemotherapy. All right. Here's the difference. The chemotherapy stays, how shall we say, works over a period of time, okay, like 12 hours. Radiation therapy is like being shot with a gun, right? The radiation strikes the and radiation therapy, they try to focus the radiation so that it hits precisely, so it doesn't hit an area. They try to hit exactly where the tumor is, right? They try to pinpoint it nowadays. In the olden days, they radiate the whole area. Now they are able to narrow it down. So the radiation therapy works immediately. Okay, that means it straight away hits the tumor, and then the tumor is damaged. All right, and it damages the DNA of the cancer cell. And then that's where the cancer cell will start to be weak and everything, and that's how radiation therapy works. So with radiation therapy, you don't have that lagging effect of chemotherapy. So it's really during that time that they shoot the radiation into your body. So immediately after that, what you want to do is already start to try and flush out the radiation that may have that is spreading in the nearby areas. So this is where the PPARs is just going to help manage the inflammation. It's going to help manage the repair of your cells around the area that was irradiated. So it's a bit different from chemotherapy. Okay, I hope you can see the difference, right? So you imagine chemotherapy is like chemical warfare. They put the smoke bomb, and then you see the whole area smoke. So it lasts for a little while, right? You want the smoke to last for a little while on the battlefield, right? But then radiation is more like an artillery shot. Boom, explode immediately, instantly, hit the target. All right, then after you hit the target, you can do the repair work already. Whereas for a smoke bomb, you don't want to throw the smoke bomb and then immediately take the fan and blow the smoke away, right? You want the smoke to stay there. That's for a little while, right? You don't throw the smoke bomb and immediately take all the big fans to blow the smoke away. So that's the difference between radiation therapy and chemotherapy. I'm using analogies so that you can better easily understand what I'm talking about. Right? Does it make sense to you guys? Yeah.
Okay, last question. Follow-up question from Miss Amy, the one who asked if she can take PPARs before surgery. So now she's asking, can I take liquid and powder at the same time before surgery?
Okay, you can, but sayang, not necessary. I'm so glad if you want to take both, but actually not necessary. If you take the liquid, you really don't need to take the powder on the same day. Unless you say you take liquid in the morning and you take powder at night. Okay, then it makes sense. Okay, then it makes sense. Why? Because with any nutrition that you take, anything that you take into your body, it will work only for a certain amount of hours, right? Just like chemotherapy, it works for 12 hours, right? Then after that, the effect starts to go down. Just like you take any diabetic drug, right? You have to take it 3 times a day because it only works for 4 hours, right? Yeah, like antibiotics. So there's a lifespan to the strong effect of the whatever you're taking. So if you take liquid in the morning, yeah, and you want to take powder, don't take it at the same time because sayang, overkill lang. The liquid is already much better than the powder. So if you want to take a combination of the liquid and the powder, this is what I would do. You take the liquid in the morning, all right? And then like before you sleep, right? 12 hours later, you take the powder. So that while you're sleeping, you sort of boost the effect again. So it's now, the PPARs is now working in your body like at a high level for 24 hours. Okay, so if you want to combine the 2 products, you can, but do it this way. But don't take it at the same time. Sayang, the liquid is already it's already the best. You don't have to take the powder at the same time. But you can take the powder 12 hours later so that the liquid works for the first 12 hours. And as the effect starts to go down after 12 hours, it's still having effect, but it's dropped, right? As time goes by, it drops. You use the powder to bring up the efficacy again throughout the night. Then you have a 24-hour PPAR agonist activity stimulating your body to repair itself and to stay healthy, strengthening the immune system. So I want to first congratulate Cruz because the biopsy came out negative. So congratulations. Okay. So that's good news. I'm sure you're so happy that it's good news. Okay. Yep. So now you're just waiting to make your strategy now, and your goal now is to prevent recurrence. So you have the right strategy, which is to strengthen your immune system. Now try definitely to modify your lifestyle to be make it healthier, right? So for me, like for myself to be healthy, I have cut down my meat intake. I'm not a vegan, okay? I'm not a vegan, but I've lowered my meat intake by at least 50% compared to earlier days. All right. I still enjoy a good steak, but in general, I've also changed my lifestyle because I'm turning 50 years old this year. Okay, so I want to be healthy. I just met up someone who ran a half marathon, which is 21 kilometers, and he ran it at the age of 74. So I was very inspired to also be very healthy as I age. And I congratulate Cruz, and I hope that you will be able to run a half marathon when you're 74 years old, so that we can all live healthily and in strength.
Wow, that's very inspiring. Okay, so last question na daw talaga. Okay, then after surgery, can she still take PPARs? Okay,
Yes!
the whole family is listening, sir, so
okay,
enlighten
good.
them.
Okay, good. Okay, so since the whole family is listening, let me explain what is the efficacy, all right? Or how does it work? It's important. Once you understand how it works, you'll be more confident on how to use it, right? Alright, so here it is. The part that you want for yourself for surgery is this, right? I'm sure you realize if you have especially major surgery, the doctor will measure your blood sugar levels before you go into surgery. So if you are diabetic, they will pump you, they'll make you take anti-diabetic drugs. Okay? Why? Because diabetes will have an issue with your blood clotting. Okay? That means your blood will not clot. that's not good because then you will keep bleeding, right? So you want to be able to stop the blood flow after the surgery. So that's why they want to make sure your blood sugar levels are healthy. Okay, so taking PPARs helps maintain metabolic syndrome. So diabetes, blood cholesterol, all this, right? So that's how it can help you with your recovery. Next, we talk about cell delineation. We talk about cell delineation. What is cell delineation? Cell delineation is basically making sure your cells grow properly. Okay, so after surgery, what is going to happen? Your body is going to repair the cut, right? Because you cut, so they now need to put cement. So imagine your body is going to send cement over there to seal the cut. So that it's new cells growing to close up the hole, both outside and inside. All the cuts internally, the body is also going to repair itself where it was cut. So the repairing work is your cell growing. So this is again where the effect of PPAR agonist comes in. It helps with cell delineation. That means it helps the cell to be grown correctly. So let me give you a construction analogy. It's like you want to patch the hole, right? So you're gonna make cement. So PPARs makes sure that your cement mix is high quality. Because if your cement is low quality, they didn't mix the cement properly, you didn't use enough sand, didn't use enough water. When you patch up the hole, it's going to crack later. Why? Because the quality of the cement is not good. So even though you patch up the hole will leak, right? So PPAR will help to make sure that the cement is of as good quality as possible. So that when you patch up the hole, everything will be well. So if you understand it this way, you can understand now why after surgery, when your body is going to try and repair all the cuts inside and outside, this is the time you want the action of the cell delineation, right? To make sure your cells replicate correctly. Okay, so that's how it works. And last but not least, we mentioned it again and again. Cell delineation in your bone marrow would mean that the red blood cells production will be healthy, and also the white blood cell. Both are important, right? So this is why your surgical room is sterilized, because they cut open and now bacteria can go inside. That's why the operating room must be clean, so that virus and bacteria will not be there and go inside your open body. So again, the white blood cells is your immune system. Your red blood cells are necessary for everything. And these blood loss, both will be lost during the surgery, right? Both will be lost during the surgery. So in your recovery period, your body will be doing its best to make new red blood cells and white blood cells. Again, that's not a bad thing. It's a healthy thing. That's why blood donation causes your body, when you donate blood, blood leaves your body and your body produces new ones. And the new ones are younger blood, right? Newer blood. And that's a good exercise for your bone marrow, right? So again, this is where PPARs will help. So again, I'm sure you can see how it works. All right. So there you go. Oh, someone is sharing. Yeah, there you go. Glenn's, right? PPAR protocol helped my mom in her stage 4 lung cancer journey. She took the combination of powder, then the tablets, no longer coughing with blood. Second CT scan showed significant reduction of cancer mass. Thank God, yeah, thanking us. Thanks to Dr. Tapia and Dr. Jansen as well. Yes, we look forward, Glenn, to seeing you on July 27th. All right, Jhen, I think, wait, I just want to answer this one. Ispana, tongue carcinoma. Please send a message to a CSO. We actually had Doc Johan, and his case was exactly this. The patient was tongue carcinoma and had a full recovery. So you can watch that video. That will answer your question. So the answer is yes. All right. It will help with your fight against tongue cancer.
Okay, I'm afraid that's all we've got time for today.
All
Sorry,
right.
I can still see a lot of questions coming in, but don't worry, we'll answer each of your questions next webinar or via direct message. And just before we say goodbye, kindly give our viewers your parting words for tonight.
Tonight is so wonderful. Very good questions, everybody. Yesterday, I had my talk with doctors, right? So again, the discussion was very much like what I explained to everyone tonight. Instead of just saying yes or no, I explained to the doctors how the product works, just like what we tried to share with you tonight. Of course, tonight I use a lot of I use less medical terms. I use analogies like cement and things like that so that the non-medical professionals among our viewers, is easier for everybody to understand, and it's sufficient to understand it this way, right? Because that will give you enough understanding to know why you're taking PPAR protocols and how it's helping you. So again, thank you everyone for joining me tonight. And I want to encourage everyone, it is important to know how the drugs, medications, and protocols are working in your body, so that in your everyday life, you will know how to help the drugs and protocols that you are using work better, because you understand how it is working. All right. So I believe every one of us are very capable of making changes and adapting. So yeah, so I hope tonight's knowledge will help you in adapting so that you can fight your cancer better. And I have a good weekend, everybody. I'll see you guys next Thursday.
Thank you, Sir Shyan. We hope to see you again in our future webinars to come, same day, same time, every Thursday night at 7:30 p.m. For next week, July 11, we will learn more about signaling pathways and how to make your maintenance medicine more effective the PPARs way. But before that, this Sunday is the start of Lazada 7/7 Mega Sale. So check out participating items like Cleansing Plus, PPARs Plus tablets, and PPARs Soft Gel Capsule only from the official Lazada Mall of Simply Nature. Lastly, I'm so excited. It's less than a month to go. This July 27, Saturday, we are calling again all cancer patients, survivors, and advocates. Let's all come together to beat the odds using medical nutrition, oncology, surgery, and PPARs in fighting cancer. And this seminar isn't just about learning, it's about empowerment, because every health journey is unique, but you are never alone, and together, we are stronger than cancer. You can reserve your seats as early as now via GCash payment. Just scan the QR code flashed on your screen. Okay? And thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group, because your curiosity about your health condition and your victory over cancer and metabolic diseases is what keeps us going. Here in Simply Nature, we are always with you from start to healing. Thank you, everyone. Good night and God bless you all.
Hi everyone! Have you ever wanted your oncologist, your surgeon, and your integrative doctor all on the same stage at the same time to answer your questions about cancer and your cancer journey? Well, the opportunity is now right here. It's happening. Simply Healed is going to have its second face-to-face event, Beating the Odds, Medical Nutrition, Oncology, Surgery, and PPARs in Fighting Cancer. So join us on July 27th at SMX Aura, 8 a.m. Click on the links below to register for on-site or join us via Zoom. See you there, July 27th. Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
today with a Simply Nature Power Pack, a 5-day combo pack of Simply Nature PPARs tablet for immune boosting and Simply Nature Cleansing Plus for effective detoxification. Now is the best time to try our Simply Nature products. Available on our official Shopee, Lazada flagship store, our website www.simplynature.asia, and our office in BGC Taguig. Order yours today. Click the link on the description box.